The last portion of the talk is on noses, and what we're going to talk about are the typical things that patients don't like about their noses. So some of the most common examples are humps, droopy noses, wide noses, long noses, noses that are maybe too upturned, noses that are flat and wide, noses that are asymmetric or crooked, and then sometimes they're noses that have had previous surgery where they have some issues that they need some corrective work. And then lastly, there's also some breathing issues, breathing concerns. Here's a very simple example of somebody who had a bump on their nose that they didn't like, a bony bump. You can see afterwards, it's a nice, smooth, natural result, nothing too excessive. A little bit of work done around the tip. So as you could see, even though she had the bump here, I noticed that her tip projection was not as good. Her tip just was a little bit shorter, a little bit hooked. This way, the tip just looks a little happier, a little stronger, and just a good balance between her bridge and her tip. Again, here's another example, a small bump on the bridge, a tip that's perhaps a little bit weaker. Again, we build a little bit of support and projection in the tip, reduce the bridge. So it's really all about balance and relationship. It's about how structures transition from one into the other. Noses that droop. There's a lot of things going on with this nose. Obviously, the droop is a portion of it. Her excessive nostril show is also a big factor. There's kind of a certain amount of nostril that you want to see in the side view that is considered okay. And if it's much more than that, that becomes distracting. That becomes excessive. Here, we reduce the nostril show. We reduce the hook and droop and slight reduction of the bridge to create a more aesthetically pleasing nose. Again, same thing, a little bit of a droop, a little bit of an excess nostril show, small bit of a bump. A lot of African noses and Southeast Asian noses tend to have what's called poor tip support, meaning that the tip does not project out, is not as strong. It tends to be flatter against the face. It needs to droop down. So in a lot of these noses, we have to build some support in their cartilage. If you think of the upper lip and the nose forming an angle, this angle needs to be 90 degrees or more. When it's an acute angle, when it's an angle that's less than 90 degrees, then that means that the nose is a little droopy. Yes. The question about a lip lift, lip lifts and rhinoplasty do oftentimes happen at the same time. I generally feel that it's better to do the rhinoplasty first because sometimes what may seem like an overly long lip, once you do the rhinoplasty and make the corrections, all of a sudden it does not, and you have, been able to save the patient from having another surgery. So here, you could argue that she did have a little bit of a longer lip, but by kind of lifting the nose, all of a sudden the balance looks a little bit more ideal. I generally don't like to do those at the same time. So noses that are wide, so again, both the bony part and the tip can be wide, and there are procedures that we can do to narrow those noses. And here's another example. Some noses just appear to be long. Now, whether it's long in how much they stick out or just the overall, length. Again, here's another example of a large nostril. The nostril is almost crowding into the lip. If you look at his lip, there's not enough height to his lip just because the nostril is almost extending down into the lip. And where afterwards, now we have a little bit more of a balance between those two structures. Rhinoplasty is sometimes about adding, not just removing. So with him, he had a bit of a deep transition from his forehead to his nose. And actually, I built that area up to create a better aesthetic in his forehead to nose transition than he had before. Again, here's another example of a long nose. So a nose that's droopy and slight bit of a bump. She was a petite young woman and kind of wanted a nose that's a little bit, kind of cuter and, more feminine. So we gave her the nice lift that she asked for. Generally 4 months, sometimes 6 months. It all depends on when I see them back. But yeah, generally they're in that 4 to 6 month window. This is an example of someone who did not like that her nose was a bit upturned. She thought that, she was showing too much nostril, and she had not had any prior rhinoplasty. This was just her natural nose. So what we did for her actually brought the tip down and made the angle between her lip and her nose a little bit smaller and reduce her nostril show. So again, you can also do things that are opposite of conventional, meaning not everyone wants their nose lifted. There are people who want it to go the opposite direction. This is an example of a nose that is both a revision and was upturned. So she had a prior rhinoplasty and things didn't go, well with her. And she had this kind of unnatural upturned look, which, I corrected for her. And, she's got a much more natural, look to her nose. Again, flat bridges. So this is what we're talking about a Southeast Asian nose where their bridge tends to be lower and flatter. So in these situations, we typically use their own cartilage, which usually comes from the rib to help build the bridge out and give them a stronger bridge. Again, here's another example of what we call augmentation rhinoplasty, basically building the bridge up higher. Noses can be asymmetric, they can be crooked. So here you can see the whole nose kind of gradually leans towards the right. So, there are things that we can do to alter the angle and shape of the cartilage to make the noses more straight. Again, you can see even here, starting at the bone, the whole nose starts to deviate to the right and much straighter afterwards. In terms of when you have to get cartilage from the rib, it does add a component to the recovery beyond just the nose alone. Most patients who have rib grafts feel a little sore in their chest for maybe a week. It's almost like a crampy feeling, like you went to the gym and you were maybe doing too many bench presses and, maybe you pulled something, but typically, patients who do racket sports like tennis, even after a rib graft can usually go back, within a week. Yeah. So not too bad. Yes. Asymmetries, of course, it depends on what the root cause of it is. We have a number of tools that have to do with what we do to bone, what we do to cartilage, what we add that can help, essentially gradually make a nose lean towards the direction that we want it to go to. Some noses are asymmetric because our faces are asymmetric. So there are some situations where, we look at someone's face and the nose appears to be leaning towards one direction. But when you really look, the whole lower face, the bone structure, the teeth, the chin, everything is leaning that way. So in those circumstances, it's not just the nose, but it's the entire facial skeleton that's asymmetric. This is an example of a revision rhinoplasty. So again, this is a nose that was overly scooped here, a little too much fullness and potential scar tissue here. So again, this is what we accomplish with a revision rhinoplasty. Again, going from something that looks a little unnatural and operated into something that looks more natural. This is another revision case. Again, she didn't like how her nostril really drooped down and she kind of had these sharp shadows on either side, almost like her tip was being pinched. And again, a much more natural result afterwards. And this is the same one that I showed you before. Again, she was a revision and this is her front view. Again, you could see that kind of looked this sharp kind of piece of cartilage, which afterwards looks a lot more natural. And then, of course, there are situations in which people have either nasal valve collapse or significant deviations of their septum. And these are also things that have to do with the anatomy of the nose, which we can help improve. And I think that's it.